Good morning, everyone. I'm happy to welcome you all to our 8th edition of Zulekha Hospital's Cervical Cancer Awareness Campaign, Chance to Change. Considering the ongoing pandemic, we are meeting you online, that's virtually today, thanks to technology. Thank you all for being with us here today. The Chance to Change campaign aims at promoting early detection and prevention of cervical cancer, and we've been doing it for over 8 years now. This is going to be our 8th year, as I mentioned before. We are honored to have with us Dr. Pamela Munster, Professor, Department of Medicine, UCSF, Director, Early Phase Clinical Trials Unit, co-leader of the Center for BRCA Research, and co-leader Molecular Oncology Program, UCSF Helen Diller Family Comprehensive Cancer Center. Dr. Munster will be chairing the panel today along with our other doctors. That's Dr. Lakshmi Aliwal, Dr. Soha Abdul Baki, Dr. Nida Iqbal Shapu, as well as Dr. Nora Sharafi. Before we get into the panel, we would like to give you a message from Her Excellency Noura Al-Kabi, who is the Cabinet Member and Minister of Culture and Youth, UAE. So let's have the video.
Cervical cancer is one of the leading causes of death for women, and early screening can help prevent such disease. A vaccination of an age as early as 9 years old is so important and crucial for girls. It's important that you go for screenings to help also detect and hopefully prevent you from such disease.
Discover the ultimate healthcare experience.
Okay. Yes. Welcome, everyone. So I'm pleased to welcome you all. Good morning. I'm happy to welcome you all to our 8th edition of Zulekha Hospital Cervical Cancer Awareness Campaign, Chance to Change. Considering the ongoing pandemic, the year has been difficult, and we are meeting you all online. Thank you for joining us today. The Chance to Change campaign aims at promoting early detection and prevention of cervical cancer. We are honored to have with us today Dr. Pamela Munster, who is the Professor for Department of Medicine, UCSF, Director, Early Phase Clinical Trials Unit, co-leader of the Center for BRCA Research, and co-leader Molecular Oncology Program, UCSF Helen Diller Family Comprehensive Cancer Center. Dr. Munster will be chairing the panel today, along with our other doctors, that's Dr. Lakshmi Aliwal, Dr. Soha Abdul Baki, Dr. Nida Iqbal Shapu, and Dr. Nora Sharafi. Before we get into the panel discussion, we have a message from Her Excellency Noura Al-Kabi, which we would like to play for all of you. It's an endorsement she has sent for this campaign. Let's have the video, please.
Cervical cancer is one of the leading causes of death for women, and early screening can help prevent such disease. A vaccination of an age as early as 9 years old is so important and crucial for girls. It's important that you go for screenings to help also detect and hopefully prevent you from such disease.
Discover the ultimate healthcare experience.
Yes, so that was the message from Her Excellency Noura Al-Kabi. To continue with our event today, let me once again introduce Dr. Pamela Munster, who's been our campaign ambassador for years together for different campaigns promoting the early detection and prevention of cancer. Dr. Munster, as I mentioned before, is a professor for Department of Medicine in UCSF. She's also a director, Early Phase Clinical Trials Unit, co-leader for the Center of BRCA Research, and co-leader Molecular Oncology Program, UCSF Helen Diller Family Comprehensive Cancer Center. Welcome to the event, Dr. Munster. Over to you for the session.
Thank you, and welcome everybody. And it's with great pleasure that I'm here joined by Dr. Lakshmi, Dr. Nida, and Dr. Nora, as well as Dr. Soha. And I'm hoping this will be a very informative session, and my great hope is of course also that this will entice many of you to really take the prevention and screening for cervical cancer seriously. I would like to share my screen for 1 second so I can show you a little bit more about what cervical cancer is and how important this is. As you see here, cervical cancer is still the third most frequent cancer in the world. And if you look at the world map, you see there's still many countries in red, meaning that they have very high incidences of cervical cancer. Cervical cancer is a fatal disease when it's detected too late. A bit of a success story, Dubai and the UAE are now in the green, suggesting that they're really much fewer cancers. So I feel like over the last years, we have made great strides in regards to cervical cancer, early detection and screening. However, if you look at the UAE, the rate of cervical cancer is still 7 per 100,000 women. Still 93 women are diagnosed, of which 28 women die. And as you can see here with the diagnosis, a lot of women still die. This is a young cancer for women between the ages 35 and 55. Median age of diagnosis is 45. It's the second leading cause of cancer in women and the 7th leading cause of cancer deaths. Most importantly, the message I want to convey today is that early intervention and prevention has a cure rate of over 90%. So this is a cancer that no one needs to die from anymore. Back to our panel. May I please call on Dr. Nora?
Yes.
What are the causes and what are the risks for cervical cancer?
Good morning. Almost all the cases, or 99% of the cases of cervical cancer, are caused by infection by human papilloma virus, the high-risk ones, type of that virus. The virus will attack the cervical cells and cause changes in it. The cervical cells can be affected by the human papilloma virus. The human papilloma virus is a very common infection in women, but the infection, fortunately, most of the infection will resolve spontaneously without any intervention, because our immunity system can clear the virus, and it is a good thing. If the infection persists for a long time, it's like for over a long time, maybe 10 to 20 years, the virus can cause changes in the cells, which can lead to cervical cancer at last. So detection is very important to catch these changes in the cervical cells. Other risk factors also can be there, but if the patient or if the woman is a smoker, is have like low immunity or immunocompromised patient like HIV patients, and the women with like multiple sex partner also is at a higher risk to have the infection with the papilloma virus.
Dr. Nora, so you say that that virus is actually quite common. So
yes,
do
yes.
all women have this? And where do you find this virus? Where does this virus where's this virus located?
Okay, the virus already very common virus. It's like transmitted by sexual contact, and is transmitted very frequently.
So, but I think we know that there's probably almost 100% of women carry the virus, and it's in both men and women. So yes. How is it, can you go through this again? How is it that not everyone has this infection?
Yeah, almost everyone could have the infection on the skin, on our body, and it's like regarding the type or the high risk type of the human papilloma virus is like transmitted through the sexual intercourse or sexual contact.
So what happens now if a woman is worried that she has the virus? What should she do?
Okay, if the woman is tested for the human papilloma virus and it came positive for the high risk types of the papilloma virus, first of all, we can reassure her that it's like very common. This virus is very common, and also we can advise her to do the pap smear as a co-test with the human papilloma virus if it came positive.
So can you speak a little bit, as I hear but women should have pap smears. Can you explain a little bit what does pap smear stand for and who should get one and when?
Okay. Pap smear is a test which used for a long period of time for screening for cervical cancer, that we will take a sample from the cervix or with a small brush, and these cells will be tested. If there is any changes with the cells, that means that there is a possibility of having the human papilloma virus. So usually we are screening the women between the age of 21 till the age of 65 by the pap smear, to be done like every 3 years. And no need to test before the age of 21. I can't speak about the recommendation, which has come from the American College for Obstetrician and Gynecologists. They advised recently in April 2021 that no screening before the age of 21, and between the age of 21 to 29, we can screen the women by the pap smear every 3 years. And after the age of 29, like from age of 30 to age of 65, here we have 3 options. We can screen the patient or the woman, by the pap smear every 3 years, or by using the human papilloma virus test as a primary test alone, or to do every 5 years, and to do the co-test, the pap smear and the HPV test together every 5 years from the age of 30 to age of 65. Going here to UAE, the head of the Department of Health in Abu Dhabi, her last recommendation for screening for cervical cancer is to start screening at the age of 25, and to do the pap smear between 25 to 29 years, every 3 years. And then after or from 30 to 65 years, we will use the co-test, the pap smear and the HPV test together every 5 years. But also, we can advise all women to do the pap smear every 3 years, beginning from the age of 21, or when the woman is sexually active, every 3 years.
Okay. So if a woman is not sexually active at 21, does she need to start doing pap smears then?
No, here, we cannot do the pap smear test for sure.
Okay, so there's no need for it.
No need, yes. Yeah, for sure.
Okay. And then when over the years, this has been a new recommendations, right? When I was younger, the recommendations for pap smear were pretty much every year. Do you want to explain a little bit why we're not doing pap smears every year anymore? And I frankly think this is quite a good recommendation, and it makes it much more likely that women actually will come in and get the pap smear done.
Very, very difficult to bring the patient every year to do the screening, first of all. Also, the infection is very common, and it can resolve spontaneously. So no need to put the women under stress to come every year to do the testing.
Okay, and what is the co-test? Can you explain a little bit? There's the pap smear where you look at cells.
All over the world now, in the many cervical screening program, they added the co-test that will be done every 5 years. So we are taking the sample through the cervical pap smear, and we do both the HPV testing that we detect the human papilloma virus DNA, the high risk ones in the cervical cells. Plus, we are checking the changes of the cells by using the pap smear. So both can be done together.
Okay. Dr. Lakshmi, so now someone has been diagnosed with an abnormal pap smear. Can you please help us understand what that actually means and what we do about that?
Abnormal pap smears means that the cells which we scrape out from the cervix, either from the outer part of the cervix or inner part of the cervix called as endocervix, there are some cellular changes. There are some changes in the cells because of the human papillomavirus and because of low immunity. This HPV virus gets incorporated into the cells and produce changes in the nucleus and produce abnormalities in the cells. So if the smears are normal, that means your cells do not have any changes which have happened. Whereas if cells are abnormal, there can be of two types. There can be of a low-grade change or a high-grade change. If it's a low-grade change, just routine follow-ups would be sufficient, and some of them they resolve on their own. There's no need of treating them. If it's a high-grade lesion, there's a high likelihood that they can progress to a cancerous stage. So they need some kind of treatment, either excision, or we have something called as cryotherapy or electrotherapy, or excision is like removal of that abnormal area. If there are some situations where the cells, we cannot determine whether it's abnormal or normal, it's like an unconclusive phase. In that case, if at all HPV testing has not been done, we recommend to do HPV testing. And one more thing, if abnormal smears are obtained, we do something called as colposcopy. That is, we magnify the cervix and visualize if any abnormal cells are there. We apply some liquids like acetic acid and Schiller's iodine, to identify the abnormal areas and take specific biopsies from there, or to plan the management.
Okay, Dr. Lakshmi, now this is a lot of big words there. Like, can you explain this in a little bit more, less medical terms, so that the maybe average person can understand what high grade and low grade and colposcopy means?
Colposcopy is a little advanced way of detecting if the cells are abnormal. That is, we magnify the cervix. We have a specific machine called the colposcope, wherein we look at the cervix and we magnify the image of the cervix and look for abnormal areas on the cervix. And if any abnormal areas are detected, we take a piece or a tissue from that area and we send it for testing, which will be tested under microscope to see how much is the abnormality and at what level the abnormality is.
So how is this different from a pap smear then?
Pap smear, we are taking out the cells, which are...
how do you take out the cells?
We have certain instruments called the spatula or some brush wherein we can take the cells from the cervix. Here in colposcopy, we try to take biopsies. We take a chunk of the tissue to get a proper assessment of the problem.
Does that hurt, Dr. Nora, Dr. Lakshmi? Does a pap smear hurt?
No, pap smear is like a discomfortable examination, but it doesn't hurt. By good lubrication and introducing the speculum, which we are using to take the pap smear, will be like a little bit uncomfortable, but it's acceptable also.
So in a way, the pap smear is really like taking a long Q-tip and taking a brushing of the area and then transferring it on a slide. I mean, it is not the most pleasant of all exams, but I think it shouldn't hurt. Whereas if you do, as Dr. Lakshmi says, colposcopy, where you're actually looking at the rect cervix, and you take a biopsy, that may be a little bit more painful. I assuming, Dr. Lakshmi, you do a cervical numbing? You give a block before you do a biopsy? Do you give numbing medicines for that?
I didn't get your question. Huh?
Are you using some form of numbing medicine or a little bit of anesthesia for that, the local anesthesia?
No, colposcopy can be done without anesthesia. It can be done as an OPD procedure.
Ooh, I have to say though, the American women are a little bit more demanding. We get numbing medicine. Okay, but let's not ever get there. We don't want to have women who have abnormal cervix findings. We don't want to have things. So how do you prevent getting to an abnormal pap smear? It's like back to you, Dr. Lakshmi. How can you prevent cervical abnormalities?
We have vaccination available. The newer generation are lucky. We didn't have when we were young. The vaccination programs are available. In few countries, it's mandatory. It's mandatory to take the vaccination now. The vaccination for HPV, it prevents the HPV infection. If at all they haven't had the HPV infection of a certain strain, it will prevent the HPV infection, and this will prevent from the cellular changes from happening. So this HPV vaccine can be started as early as 19 years of age, and if it can be given within 15 years, that will be very good. But there is some extended who have not yet received the vaccination up to 15 years, that can be even extended up to 25 years. And there are few countries wherein the vaccination program has been extended up to even 45 years of age. There are so many types of HPV viruses which have been detected, up to about 120 types. And if at all a woman is infected with one kind of HPV virus, this vaccination is not going to be effective in preventing the already infected virus. But the other strains, if they are going to infect, it will prevent her from getting the infection because of the new strains, from the new strains.
So back to you, Dr. Nora. When so it appears from what you two are saying is like the vaccine really needs to happen before someone is sexually active. Yeah.
Yeah, yeah.
And then I think as you go through life, even if you have been infected, the vaccine is still active because it prevents further infection. So I guess. So would you recommend that women have the vaccine?
Yeah, I would recommend the women to have the vaccine, even if they are sexually active or they already have been infected with the infection, because there is multiple types and many types of the high-risk human papilloma virus. So we recommend the women to take the vaccine until the age of 45.
Mm-hmm. Very good. And what about boys? Because like in the measles, I mean, there's usually it doesn't help to just vaccinate half the population. How do you feel about vaccinating boys?
Yes, even there is a recommendation for vaccinating the young boys. Again, from the same age, when we vaccinate the young girls, at least it will prevent the genital warts, genital cancers, and the anal cancers in men. And we have to take this opportunity to educate even the parents to even get their boys vaccinated, at least to prevent some kind of the anal cancers and the genital cancers in boys. Yes.
Do the vaccines have a lot of side effects?
Yes, not very serious side effects. It's just like pain or swelling or the side effects which any other injections can have. There's reported few cases of syncopal attacks, but then that is a very mild form of side effect. Only thing we advise them, once after vaccination, they have to be sitting in the OPD for 15 minutes just for observation. Other than that, there are no major side effects known.
And Dr. Nora, can you speak on how many vaccines you need?
Already we will need 3 doses. First dose will be given, then second dose will be after 2 months, and the third dose will be after 6 months from the first dose. So 3 doses.
Okay. Okay, thank you, you doctors. Let's go over to our oncologist and find out what actually happens when you have cervical cancer. And again, I think the most important part is that no one should get cervical cancer. Dr. Nida, what are the next steps after a diagnosis of cervical cancer? You need to unmute yourself. You're on mute.
Thank you so much for having me here and talk about this important topic today. Unfortunately, cervical cancer is highly preventable and curable if detected early. Once it's been diagnosed, and then it's when the role of oncologist comes into place. The patient is being referred to us, and the next step becomes like we need to stage the disease. Staging means to know the extent of cervical cancer. So the staging is generally done by pelvic examination under anesthesia to know the extent of local extension. And in addition to that, we need imaging studies like ultrasound, CT scans, MRI pelvis, or PET CT scans. We will also require cystoscopy to know the involvement of bladder, and proctosigmoidoscopy to know the involvement of rectum. So these are how we proceed. We need to know the stage of disease. There are 4 stages of cervical cancer, from stage 1 to stage 4. The staging is really important because this helps us in devising a treatment plan, and also to know the survival and prognosis of the disease. So unfortunately, as the stage advances, the treatment becomes more complicated. It comes with a lot of side effects, and the survival also reduces. So this is what the next step is, to know the stage of disease.
Okay, and then once you know, let's say, is there different outcomes by different stage? Is it worse to have stage 4 cancer?
Unfortunately, yes. Stage 4 cancer is already a metastatic disease, which has already spread to distant organs. Before stage 1, we also have stage 0. Stage 0 means that it's still a precancerous stage. Precancerous, like the cancer has, the disease has not yet invaded the basement membrane. And that is why the screening is important, because screening detects cancers at stage 0 and stage 1 disease. So if the screening detects cancers at stage 0 disease, the disease is almost like 100% curable. Even in stage 1 means the disease is still restricted to the cervix. Even in stage 1, with proper treatment, the survival approaches almost 93–94%. So as the stage advances, the survival reduces to around 60% in stage 2 disease, and further to 36% in stage 3, and unfortunately 17% in stage 4.
So if a patient presents with bleeding, and she sees Dr. Lakshmi or Dr. Nora, who both find an abnormal pap smear on a colposcopy, and you then diagnose a stage 2 cancer, Dr. Soha, what's next? Are there any options for these patients, or what is next?
Yes. Good morning. Good morning, everyone. Thank you, Dr. Pamela, and thank you for the audience. Actually, I hope that no one will be diagnosed with cervical cancer. And as you said, the best thing is to prevent cervical cancer rather than treating it. Very fortunately, cervical cancer had a very long treatable pre-malignant conditions. So we have many years having these pre-malignant conditions, so we can intervene and prevent the progression to malignant condition. But when a patient comes with cervical cancer, there are many options of treatment. Treatment depends on the stage and depends on the size of the lump in the cervix. So if the lump in the cervix is very small, we will remove only the cervix and we preserve the uterus. If the lump in the cervix larger, so needing to remove the uterus and the cervix and lymph node, so more extended surgery. If locally advanced, treatment at such time needs combined treatment with radiation therapy and chemotherapy. So it depends on the stage and depends on the size of the lump in the cervix.
Okay, and then what types of therapies would you offer? We hear a lot about chemotherapy, but is chemotherapy the only thing you can use?
Actually, fortunately, we have many drugs now with different mode of actions rather than chemotherapy. First, I want to tell about chemotherapy. What's chemotherapy? Chemotherapy are drugs that its mode of action is to kill any rapidly dividing cells. And we all know that cancer is a rapidly dividing cells. But unfortunately, we have many cells in our body which are rapidly dividing. So the chemotherapy will kill rapidly dividing cells, which is cancer, and also normal cells. So we have some side effects. We have, other than chemotherapy, we have targeted treatments. Targeted treatments are drugs which will go to specific targets on the cancer cells. So it will attack only cancer cells and preserve normal cells. So better response and less side effects. We have now immunotherapy, which is used in stage 4 cervical cancer. Immunotherapy are not chemotherapy. It is drugs that raise and boost the immune system of the patient so it can fight any cancer. And actually, we have many immunotherapeutic drugs approved in the treatment of many types of cancers, including cervical cancer.
Okay. Now, if someone is diagnosed with stage 1 cancer, Dr. Nida, do they need all of this? They need targeted therapy, chemotherapy, immunotherapy? Or can you get is it better to present with a stage 1 cancer?
Yeah, definitely. Stage 1 cancer does not require all the treatments. It just requires surgery. That's why, because it's very early stage. That is the purpose of screening, to detect cancers in stage 0 and stage 1, because the treatment, it's less complicated. It's just the surgery. And because generally the cervical cancer, it presents at a younger age. So most of women, they desire to preserve their fertility. So there are options in very early stage 1A. If there's a desire to preserve fertility, then you can just go for conization or just removal of that abnormal area. Otherwise, if there's no desire for fertility, then the option is just surgery, which can be simple hysterectomy or radical hysterectomy in stage 1A2 or stage 1B disease, because that's a little bit advanced. So of course, yes, only surgery is the option. Then after surgery, depending on certain high risk features, then the next step would be radiotherapy. But generally, most of the cases can be only surgery can be done, and no radiation or chemotherapy. So as the stage advances, the treatment becomes more complicated with involvement of radiation, chemotherapy, and surgery also sometimes.
Okay. Now, I realized we have forgotten an important part. What are the symptoms of early stage cervical cancer? How would someone present who has early stage cervical cancer? Dr. Soha,
yes.
How do patients present to you?
Actually, they present after gynecological examination, finding abnormal pap smear or abnormal lesion inside the cervix. But most commonly, the symptoms are vague symptoms, coming with bleeding per vagina, coming with postcoital bleeding. In more advanced stage, pain will be there. Some in higher stage or more locally advanced disease, more complications like renal failure and pelvic discomfort. So the symptoms of cervical cancer and most types of cancer are vague. So it's better to prevent than to wait for symptoms. Meaning of symptoms, that a lump is there. So a lump is there, it will compress on the normal cells around and cause symptoms. And we advise all people, all women, not to wait for symptoms to diagnose cervical cancer.
But Dr. Lakshmi, is every bleeding abnormal and suspicious of cervical cancer, or can women have abnormal bleeding that's not cancer? Please unmute yourself.
Every woman who presents with bleeding is not cancer and not cervical cancer. It could be even because of benign problems. That is, it could be hormonal issue. And if it's in the reproductive age, it could be related to pregnancy and pregnancy related complications. Or if it is like around 35 to 45 years of age, it could be related to some hormonal changes in the body. Or later stage, like around more than 40-45 years, we should definitely look for cancers of the genital tract, whether it is cervical cancer or uterine cancers, or even sometimes a benign lesion like a polyp or a small growth inside the uterine lining also could cause the bleeding. So everyone should not get scared if they have abnormal bleeding. They should come to a doctor, get themselves examined, and look for suspicious lesions, or get yourself tested to look for cancers. But just remember, not every bleeding is because of cancer.
So Dr. Noah, what happened if someone has been in menopause for several years and now starts bleeding? Should they worry?
Yeah, you should be worried. Yeah, because it's postmenopausal bleeding is like always suspicious. So always women should come for examination. So the patient will be examined by ultrasound, and speculum examination to check the cervix, to check the uterus. So should be examined in urgent basis. She should come to the doctor directly.
And if you have been diagnosed with an abnormal pap smear, can you still have a baby, or can you no longer have a baby after that?
If diagnosed by pap smear, we should do more investigation, and then we will decide if she can go. If like is low grade lesions, or so we can manage conservatively, and she can get a baby. Yes, if treated perfectly.
So Dr. Nida and Dr. Soha, so even if someone has stage 1 or 2 cancer, can women still have a baby after that?
Yes, because the extent of surgery will be only to remove the small lump, only to remove the problem inside the cervix, and we will preserve the uterus. So coming early, to be diagnosed early, less surgery, and we can preserve fertility.
Mm-hmm. Dr. Nida, can you have a baby after having had chemotherapy?
Yes, sometimes, because not all chemotherapy drugs, they affect the ovarian cells. Yes, definitely. After a few years, there may be, the ovarian function may come back to be normal, and there are patients who have gone on to have normal pregnancies and babies after chemotherapy. So yes, there is a possibility of having babies after chemotherapy.
And what are the side effects of chemotherapy, Dr. Soha?
Actually, as I told, that chemotherapy will kill and intervene with rapidly dividing cells, the cancer cells and some normal cells. We have some normal cells in our body which are rapidly dividing, same like cancer cells. So chemotherapy will affect these cells. So mostly it will affect the GIT because it's rapidly dividing. Like as patient will have nausea, vomiting, the bone marrow, which produce the immunity cells. So chemotherapy can affect the immune cells. So the patient can come with low immunity. This is the most common side effects. And also hair loss, because hair follicles is rapidly dividing and the chemotherapy can affect, and the patient will have a hair loss.
Okay. Okay, so I think, Samina, should we open this for Q&A?
Yes, doctor. So we have a couple of questions which you would see on the window.
Okay. One of the question is from Matas Aga. How do you evaluate the UAE's experience in raising awareness and treatment in this field? Any one of my panelists? Let me ask this a bit more differently. Like, how do you think awareness about cervical cancer has changed over the last 10 years? Is there more awareness? Are women more forthcoming? Is there a change? Is there hope in the UAE?
Yes, it's better. The awareness is better nowadays than the last 10 years.
And what do you think is better?
It's starting vaccination, regular pap smear or examination, screening is better. Awareness, many campaigns ongoing every year. There is a campaign. So the people are already in a better awareness these days, yes.
Actually, Dr. Babella, there is awareness of cancer in general this recent years, actually, all over the world, regarding mostly the most preventable cancers, or the like breast cancer, cervical cancer, colon cancer. From my experience, which is 18 years, now I see awareness is better, much better than before.
Okay. And what are we offering from Zulekha Hospital for the cervical cancer screening and prevention?
We are starting a We are starting free gynecological consultation, and we have a free pap smear testing, which is going to start from today for about 2 months. So all women should take advantage of this service and get yourself tested. And nowadays the awareness is better. Women do come asking for pap smears regularly. They do come regularly. Unlike before, we had to, whoever is to come to our gynae OPD, we used to take that as an opportunity to screen them. But nowadays, they come looking for a pap smear. So the awareness is better now.
Okay, and one person asked this very important question is like, are there suggestions for lifestyle changes that help with prevention of cervical cancer? Anyone?
Yes, lifestyle changes will improve our immunity. So our immunity have a big role to eliminate the virus. So it's also important thing.
Okay, but what are lifestyle changes? I from my times in UAE, I know that shopping is a major national sport. So what are those lifestyle changes?
Go with the healthy food, exercise regularly, reduce weight if there is obesity. So this is the most important life change.
Smoking.
Lifestyle changes.
Okay, so smoking is related to cervical cancer?
For sure, yeah. Sorry, yeah, you should stop. Yeah, it's very important.
Okay.
Yes.
Okay, there's definitely, and you counsel you women when they come to the clinic of not smoking?
Usually in our clinic, we are not asking this question regularly, but there is some patients who are smoking really.
Mm-hmm. And do you counsel on secondhand smoking?
Yeah, for sure, we can ask for that.
Okay. And what about another question? Can you tell us more about stage 4 cancer, please? Maybe that goes to Dr. Soha, Dr. Nida.
Yes, the stage 4 cancer is actually divided into 2 stages, stage 4A and stage 4B. Stage 4A has when the cancer has already gone into the bladder or the rectum. So, and stage 4B is when it's already distant, which has gone to the lymph nodes in the pelvis, which has gone to the liver, gone to the lungs and bones. So stage 4 has got 2 stages. And unfortunately, both the stages chemotherapy only, and now the advanced targeted therapy and immunotherapy has also come into place.
Okay. Another question is, what are the percentage of getting infected after taking the vaccine? What's the likelihood of getting cervical cancer after being vaccinated?
Vaccination is not 100% protective against cervical cancer. That every one of us should understand, because the HPV virus strain which is used is 16 and 18, and few other strains in the new Gardasil 9 vaccine. It will prevent against the HPV infection of these strains which are there in the vaccine. So the efficacy of the vaccine is said to be about only 70% to prevent cervical cancer. So once vaccinated doesn't mean that you should not screen for cervical cancer, because we still have that 30% risk of getting cervical cancer. So your regular screening for cervical cancer, that's the pap smear or the HPV testing, has to continue in spite of having the vaccination.
Mm-hmm. That's good to know. So essentially, it is very helpful to get the vaccine. It's not 100%, but I think with the regular screening and early detection, no one really would have to die from this disease. Okay, so other question is, how long does treatment last? I think let's take this apart. How long does treatment last for someone who has stage 1 or 2 cervical cancer?
So generally the stage 1 disease is treated by surgery only, which is hysterectomy or maybe fertility preserving surgery. So it's only surgery in stage 1 disease, and depending on if there are some high-risk features, then there's a chance of getting radiotherapy also, which may last for maybe 4 to 6 weeks. But as the stage advances, the treatment becomes more complicated and it involves radiation and chemotherapy. So in locally advanced, the most common treatment is chemotherapy in addition to radiation therapy. So the chemotherapy is generally given with radiation therapy as a weekly chemotherapy over 6 weeks. So this is what the treatment of locally advanced cervical cancer is. But for stage 4 disease, the main treatment is chemotherapy with immunotherapy or targeted treatment. And the chemotherapy, the minimum we need to give 6 to 8 cycles, and sometimes the chemotherapy may continue till progression of disease in stage 4 disease. So unfortunately in stage 4, because the aim is just palliation of symptoms, it's no more cure. So we need to continue treatment, and now the new research and new treatments have come up, like we need to give maintenance targeted therapy also, which may continue for 1 or 2 years.
Okay, thank you. So a couple more questions. So if you have cervical cancer and this is because of a virus, can you give a cervical cancer to your sisters or to your mothers?
Cervical cancer is like basically due to HPV virus, and it is caused by physical intimacy. Genetic susceptibility is a little bit less in cervical cancer, but yes, less than 1% of cervical cancers can be hereditary or because of other genetic susceptibility. So like running in the family is less for cervical cancer because it's more of a viral infection which causes the cervical cancer.
Dr. Soha, could you give cervical cancer to your sister?
Actually, cervical cancer is not a genetic disease. About 90% of cervical cancer is due to HPV infection. So it's not related to genetics mainly. It's related to
even
infection.
Genetics, you cannot pass genetics cannot pass to your sister. Is it infectious?
It's infectious, yes, but depending on the immunity of the person. So it's not like if I will have HPV infection, I will have cancer. Some people, for causes we don't know, will progress to pre-malignant conditions and then to cervical cancer. Mm-hmm. Not all.
So, but I want to reassure anyone who has cervical cancer, you cannot give cervical cancer to your sister, mother, or children. That's not possible.
No,
so
it's
this
not
is
contagious. Yes.
It's not a communicable disease.
Yes.
Okay. So what happens to HPV virus in men? Do we see male cancers that are HPV related?
Actually, HPV infection is causing about more than 70% of oropharyngeal cancer, about 50% of benign cancer. So it is linked to many types of cancers in men.
Okay, is that the reason why we should vaccinate men?
Yes, yes, sure. And also to protect the partner, also a female partner, from having this infection from men.
Okay, I think this is all the questions I have. It's like I would like all of you to have a closing statement. What's important to you, if you have a message? Dr. Lakshmi?
Cervical cancer is preventable, and we have certain modalities to prevent cervical cancer. We have HPV vaccination for young girls who haven't had their sexual contact. So all these young girls should get vaccinated. Second thing, come for regular pap smear checkups. We have facilities now. We are running free cervical cancer campaign. We have the facilities for doing free pap smears now. Please get the use of the situation. And regularly, women should come for pap smear screening.
Yeah. Dr. Soha?
Actually, I urge all women to screen. I urge all parents to give the vaccine and vaccinate their children. We have cervical cancer, which is the most preventable disease. Actually, in cancer field, as you know, Dr. Pamela, we have only a few types of cancers that we can prevent. So having one type of cancer that most preventable, and we can prevent this cervical cancer with a very morbid condition and very morbid. It's a very morbid disease with many side effects of treatment. So I urge all women to take care and to screen and to take the vaccine.
Dr. Nida?
Cervical cancer generally doesn't present with symptoms at early stages. It's only that once the person comes with the symptoms, the disease is already advanced. So that is the message, that screening is important because it will detect cancer in the pre-cancer and in early stage disease when the survival approaches more than 90%. So that is the purpose of screening, to detect the cancer at a very early stage when the symptoms have not yet been developed. So please screen yourself, because cervical cancer is highly preventable and curable disease, and it can be prevented in 100% of cases. So please screen yourself, come for regular pap smear checkups, and educate yourself, educate your friends, your family, and spread the message that cervical cancer is a curable disease.
Dr. Nora?
Again and again, screening is very important. Better to screen and to detect the disease before it comes, like in late stages. So detection by regular examination, regular pap smear, and encourage also the parents to vaccinate their children and to give the vaccine at the age of, till the age of 45. So vaccination and screening is the most important in preventing the cervical cancer.
Thank you. And before we close, I would like to give Dr. Ma'am Sanubia.
Hi. Good morning, everyone.
Good morning.
Good morning. Good morning to all those who have come in and logged in to view this very informative program. Dr. Monster, it's nice to see you again. And all the other doctors on the panel. It's wonderful to meet all of you and see you. As you know, as all of you know, or don't, this is our 8th screening campaign for cervical cancer awareness campaign, and really a screening campaign. I, of course, encourage everybody to get screened. We've been doing this now for about 8 years, and I hope to continue this for as long as there is cervical cancer. We'll be driving this campaign. We'll be trying our best to bring awareness and to eliminate what I think is very eliminatable. So I thank all of you this morning for your time, and this evening. Dr. Pamela Monster is on evening time. I thank her for taking time out from her evening to be with us today. I hope that in the next year or so, we'll do this again in person. I want to thank our sponsors who, in these difficult times have continued to support what I truly believe to be a good and worthy cause, in the sense that we're here, we can talk about this, we can bring awareness, we can eliminate this cancer. And so thank you everyone.
And doctors, just to give you a little bit of an idea how successful these screenings are and campaigns are, we have done over 4,000 free screening over the last 7 years, and we hope to increase that.
And we hope to continue more, and screening is key. Please keep your hesitation aside. Genuinely, lives can be saved. So let's do that. I think that's really important. Thank you, everyone.
Thank you, everybody. Back to you, Sumina.
Thank you.
Thank you, everyone. So with this, we have come to the end of our session today. We would like to thank everyone who has taken time to be with us. Thank you.
Thank you. Thank you, everyone.